In terms of thinking about what's ultimately going to happen and how this is going to work for most Americans, when you guys are having these negotiations, particularly among Democrats, is there an awareness that if the end result of this bill is that coverage stays as lousy and expensive as it is today, but Democrats have changed the law so that we're all forced to buy that lousy and expensive coverage, that this will be a huge political disaster? I'm worried politically that that's going to happen and sink the Democratic Party for generations, but I'm also worried that that's going to be what happens to me personally in terms of my health insurance.
Rachel, you're being logical, and sometimes logic doesn't break into these political debates, but that's the point that I'm making. I've been saying, folks, choice and competition are magical words in America. They're magical words for progressives, but they resonate all across the country. Here is our chance to link real choice, real consumer choice with the public option, and tell people, if you're getting hammered today, if you're stuck with a product you don't like, we are going to liberate you. We are going to put you in charge. And you bet, if the Congress passes somehow an anti-consumer, anti-choice, anti-holding insurance companies accountable bill, I think we'll pay dearly for it.
And I think the other thing that we've learned tonight is that right now there is a rift between some Democratic senators on the Senate Finance Committee and organized labor, and unless that rift closes, it's going to be hard to make political progress here. So I think that's going to be one of the major topics in the days ahead. Senator Ron Wyden of Oregon, good luck with the markup this week, and I know it continues tonight. Thanks very much for taking the time.
Thanks for having me.